Hi, I'm Colin Hung, Chief Marketing Officer and Editor at Healthcare IT Today. Thanks for joining us. I'm joined today by two people who are going to talk to us about identity management and the telehealth explosion due to COVID-19. That is Michael Archuleta, Chief Information Officer at BridgeCare Health Network, Mount San Rafael, and Aaron Benson, Senior Director of Market Planning for Healthcare at LexisNexis. Welcome to the two of you, and thanks for joining us.
Thanks for having us.
Thank you.
All right, so let's talk a little bit about the explosion of telehealth. I mean, due to the COVID-19 pandemic that we currently find ourselves in, a lot of organizations have really adapted or made use of the technology that they've invested in. What sort of security strategies, given that that's what you guys specialize in, what sort of security strategies should they be adopting at the same time that they're adopting this new tech?
Yeah, so you're absolutely right. We're seeing telemedicine make an even bigger debut right now than even the direction that the industry was already headed in, which has been great because it's helping individuals to be able to get access to the care they need while they stay isolated and social distancing as possible. But the key here is that as there is this greater access and more data going over the digital airways, is that unfortunately that's also creating a lot more possibility for fraudsters to step in and take advantage of that. And so what organizations really want to make sure is that that information isn't being intercepted, stolen, possibly altered, or that you don't have individuals that are pretending to be someone they're not, so that false claims are being filed. So it becomes even more important to make sure that it's the right people logging into the patient portals in order to get to the telemedicine apps and things like that, but also to make sure that that data is being protected, because really any access point to a system creates some vulnerabilities for fraud. So we've talked a lot about the importance of multi-factor authentication to protect data and do identity verification and authentication, but it's becoming even more important because as the health systems are getting overwhelmed right now just by the number of people reaching out through these digital means. They need more and more of this kind of automated way of checking for fraud and helping to protect their patients' data. So,
Mike, what are your thoughts on that?
Your perspective.
Yeah, absolutely. So thank you again, guys. And first of all, I definitely want to say thank you to all of our amazing medical staff and our clinicians just doing a phenomenal job during this massive pandemic. So thank you guys very much. And right now, the acceleration of digital transformation is truly here, as we all know it. I mean, the healthcare industry has always been behind the curve when it comes to technology advancements. You know, compared to the oil and gas, compared to the banking industry. But we're here dealing with patient lives. So that becomes a major issue on why aren't we moving forward with advancements of technology and really leading the way. And looking at this overall pandemic, the mass adoption of telecommunicating is the most explosive change to truly occur during this overall coronavirus pandemic. And what I like to say, though, especially with the acceleration of digital transformation, is this crisis has fully displayed the value of IT and digital transformation, and really moving over to how telemedicine has really risen. I mean, the volumes of telehealth consults in our organizations have really gone up several multiples since the pandemic truly struck. You know, we spun up a telehealth clinic. We brought into place all of these strong initiatives that have allowed us to successfully send our people home, bring in these initiatives, and continue to basically provide the best patient care as possible. As we all know, the Office of Civil Rights under HHS has really relaxed some of the enforcement activities on the utilization of telehealth. And some of my issues that I've seen, especially on a cybersecurity standpoint, are looking at social media, seeing individuals promoting, hey, we can use Facebook Live, we could use Twitch, we could use TikTok. I mean, we have to realize that these specific platforms are still not allowed. At the end of the day, HIPAA still applies, and that is a necessary item that we continue to basically do. And moving forward from telemedicine, since telemedicine is such in demand, we as an organization need the ability to remotely verify patients' identities, which at the end of the day is truly a core requirement, truly given the sensitivity of the data involved. So this is extremely important that we have strong identification management applications, two-factor authentication processes in our organization. Because even though HHS has relaxed these specific activities, we as an organization still need to be fully responsible and accountable on the technologies that we push out moving forward. Because if not, we're going to see the pros and cons and the issues that are associated with individuals just jumping on board on telemedicine, individuals sending their employees home, because if they have not developed a strong cybersecurity backbone, a strong foundation to allow efficient identification management processes to work efficiently, we're going to continue to see issues.
Perfect. Well, that's a great statement, Mike, and totally agree with you there. Aaron, maybe if you could help maybe the audience understand what is actually exactly identity management?
Yeah, so identity management is at its core making sure that the right person is getting access to their information and that the wrong people are not getting through. And not only that it's a real identity that is trying to access a system, but also that you actually are that identity when you're trying to log in. And so what we're seeing is that we do a cybercrime report every year, and we look at all the different types of crime, and what we're seeing is that it's becoming more and more varied. So it used to be we saw a lot on desktop and kind of more traditional means of trying to get in. We're seeing a lot more happening through mobile apps and through browsers on mobile devices. And so it's covering a lot of different types of fraud, as well as a lot of different access points. And that's becoming even more clear now as you've got employees working remotely, so they're logging in to the different access points, but you've also still got your vendors and suppliers logging in. And as some of the supplies have become, constrained, they've had to even, introduce new vendors and suppliers to try and fill some of the gaps. And so you've got people that aren't normally logging into systems now gaining access. Plus then you've got your traditional, patient access points, which have also accelerated because of telemedicine. And so when you think about all the different access points, and then you've got people logging in through mobile devices like their tablets and their phones, as well as through desktop, there's a lot of different ways that you then need to authenticate that individual. So it can be as simple as looking at the device that they're logging in with and making sure that there's nothing suspicious about the device itself. We'll see things like, did it ping off of like 5 different locations before it logged in? That could be a sign of fraud. The other piece of it then is you can do things like one-time password, or if you really want to make sure the individual is who they say they are, then you can do knowledge-based authentication questions. So there's a lot of different methods to fight different types of fraud, and the key is to match the right method to the right type of fraud, or really the type of risk that you're protecting at that given point in the access point.
So basically making sure that when I log in, I'm actually the Colin Hung that it was meant to log in, and all the methods you just talked about in terms of, is it the same device that I normally come in on, multi-factor authentication, all these things all are under the umbrella of identity management.
Absolutely.
Awesome. And Mike, I just want to go back to something you said. You said, of course, that this pandemic has really laid bare a lot of gaps in our healthcare systems. One of those gaps being identity management. What advice do you have for organizations that are maybe dealing with this?
Yeah, absolutely, Colin. So if your organization has not implemented an identification management application, I strongly consider doing so. Although this at times may be a larger IT project that's not currently feasible right now, organizations really need to make sure they have a very strong cybersecurity backbone moving forward. The thing is I'm so passionate about cybersecurity because the healthcare industry is one of the most attacked sectors out there. We all know that. And that's basically the bottom line. Because a medical record and a digital medical record has a lot more value than an actual Social Security or credit card on the dark market itself. And the reason why PHI is so valuable, because it contains an extensive amount of specific data, which again, as an organization, we need to be fully responsible and accountable for the actions and the technologies that we implement moving forward. If the organization does not have an understanding of what cybersecurity is, I mean, that's a basic start. You know, building that foundation of understanding what cybersecurity is, the culture of cybersecurity, what can it do on a financial, on an operational, on a reputational standpoint. These are major issues that we need to look at. And again, I mean, it was kind of funny, man, because when I saw all of those relaxed enforcements coming out of the HHS, I mean, I saw so many social media just promoting different kinds of applications that I was like, wow, I really hope individuals aren't truly going in that direction and taking the advice of some of these individuals to really start their overall telehealth program. But again, I always like to give the example of, we as an organization need to build a strong foundation. It's just like a home. You know, if we do not build a strong foundation, that home will basically sink. And we're seeing some of these organizations have struggling issues on implementing their telehealth program, implementing a successful and secure way of sending their remote workers home. So again, I mean, this is such a strong thing. If your organization has not implemented identification management, please do so. Look at specific two-factor authentications. We constantly talk about two-factor authentication. I mean, we utilize that completely in our organization. We have single sign-on, we have virtual clients, we have two-factor authentication. You know, we're utilizing RSA tokens. So we're putting in a massive amount of security and accountability and responsibility as an organization, so we can make sure that we are keeping our patients' information as secure as possible. And again, just like Aaron stated, you know, when we're doing telehealth, we truly need to identify that that is the person we are speaking to moving forward. I mean, we're starting to see Zoom, you know, a telecommunicating company, having massive amounts of issues, you know, where a lot of these educational systems are using them. You know, my kids are actually using Zoom on their school standpoint, and these hackers coming in and basically, you know, throwing different, you know, vulgarity on the screen and different kinds of issues. So again, you know, these companies need to focus on the importance on a strong identification management application that's really going to improve their outcomes moving forward.
So the three of us, before we got on air, we're talking a little bit about the fact that identity management isn't a destination. It's actually a journey. Both of you mentioned that it's sort of something you have to continue to work on, continue to layer and layer and layer. Can you maybe expand on that for us? Aaron, why don't we start with you?
Yeah, so we at LexisNexis, we do an annual focus group with the Chime CIOs, and what, you know, one of them stated it as each additional layer of security kind of provides an additional defense. It plugs one more security hole. And so, you know, what we were talking about before, which is as the technology and all of these advancements are developing that are helping patients, fraudsters are also getting smarter, and their sophistication and their tools is also advancing. And so the key is, as we, you know, do technology for good, we also need to make sure that we are preventing the technology from harming the patients. And, you know, I think Mike brings up a good point, which is we are seeing right now that the government has, you know, relaxed some of their regulations around telemedicine, and I completely understand why, you know, they're doing that. They're trying to make it easier, but there is still a responsibility of these healthcare organizations to protect patients from harm. So that, you know, is making sure nobody else is listening in on these calls, nobody else is altering their data, because bad data in a patient file actually can, you know, cause patient safety issues for the individual, and that's what we want to avoid. There's obviously reputational damage and things like that organizations would also consider, but I know at the heart of it all, they just want to make sure they're taking care of their patients. And so it's really important to keep up with those trends and cover the evolving security risks. And a lot of times they need to be able to look at different methodologies. And, you know, as Mike mentioned, at least two-factor authentication at each access point, sometimes more if it's a higher risk vulnerability area. But that's why it becomes so important, is this isn't something we should just do because of coronavirus, although certainly it's emphasizing the need, but it should be part of an ongoing strategy.
Mike, what are your thoughts?
Yeah, absolutely. So, Aaron, you really had some great points in regards to that. So at the end of the day, I always look at, especially when we're incorporating strong cybersecurity initiatives in the organization, that cybersecurity is not only an IT responsibility, it's the entire organization's responsibility. And that's basically the bottom line, because securing information and systems that support the healthcare organization truly involves much more than technology. And at times, it is truly often mistakenly viewed as only the information security organization's responsibility. This, again, is another issue that we continue to see as a cultural problem that's basically happening in our industry, thinking that we're bringing out these technology initiatives, but as a whole, we're not truly focusing on the need that we're looking for, that we're not coming together to say that this is our responsibility. How do we continue to, show return on investment back to the board of directors? How do we look at the finances, the operational, the reputational levels of what can happen if this organization fails to produce strong cybersecurity initiatives? We are not focusing on identification management, but we're irresponsibly throwing out and spinning up this overall telehealth clinic. That basically is a process of failure, bottom line. And that's the problem. Because even away from telemedicine, in our industry, in healthcare, cybersecurity isn't just about data security. In my opinion, it's also a matter of life and death. I mean, we are just looking at this massive amount of some advancements of how we're utilizing the Internet of Things, how we're utilizing medical devices, how now we're utilizing telemedicine, and how these hackers can come into these systems. And we talked about ransomware so much, and yes, ransomware should be an item that we should continue to focus on. But again, it's much higher than that. What if an individual came into your actual electronic medical record system, started changing medications, allergy medications, basically messing with the medical devices that are associated with yourself? These are issues that basically matter. This is a matter of life and death. And that is why, even on a board level, is having the understanding of what this all means. I mean, because you figure at the end of the day, in order for us to be successful, we need funding to basically fund our overall projects. That's the bottom line. And if our remaining executive team and our board of directors don't have the basic fundamentals or understanding of the cybersecurity program that you're developing, that could really be a major issue. But again, I always like speaking in regards to the finance, the operations, and the reputation of what cybersecurity can basically do to the organization. And this really includes all the initiatives at a 360 view of everything that we basically do. And now, of course, because of this pandemic, we're just seeing that spike of telehealth moving forward. But I'm really seeing a lot of irresponsible actions that are being taken by some organizations when they're utilizing this telehealth services due to some of the relaxed enforcements that were coming out of HHS. So again, we might see some issues in regards to this, but I hope moving forward, again, that as an organization, we are fully responsible and accountable for the actions and the technologies that we push out, and we need to be fully responsible for that. And as an organization and as the lead of technology in this organization, my overall thing has always been patient care is number one. I want to make sure that we are keeping our information as safe and secure as possible and making sure that we are implementing that telehealth strategy that allows us to validate the individual's identification. I mean, this is such critical times, man. And the thing is with these pandemics, people rush. And again, we all rush through this. But we have to do it at times in a very responsible, in a very strong cybersecurity culture manner as well.
Yeah, you're right. I mean, just because the HHS has relaxed some of those rules right now doesn't mean that when this ends, they're not going to clamp back down again, because you're right. Some of these tools just are not compliant. They might be trying to become compliant, but right now they're not. And you have to factor that into your decisions going forward, especially because you don't want that data and you don't want your systems to become unsafe. You're absolutely right, Mike. So just a final question for both of you. What's sort of one thing that you're hoping people listening to this episode will take away? And Aaron, why don't we start with you?
Yeah, I want to reiterate what Mike has said, which is, this isn't just a matter of protecting someone's data. It's not something that you do just because it's right to do administratively. It does impact patients' lives and making sure that they're safe and getting the care that they need. And so I would just encourage them, all healthcare organizations, to take that look at their systems, make sure that they've got the security in place at all of the access points, especially, now that there's even more access points happening, that they implement the right tools at those different points to make sure that they're protecting against the right types of fraud, and that they are really striking that right balance between finding, what they need to do to keep the patient's data secure and keep their safety in mind, but also so that they can continue to engage with the patients and make it as easy as possible for the right users to get through.
Right. Mike, what's your one thing that you're hoping people will take away from today's conversation?
Absolutely. So as I stated, the crisis has fully displayed the value of IT and digital transformation. It's been phenomenal of what my team has been able to do, and just the value that has come out has just been very impressive. And I think organizations are restructurizing their overall strategies moving forward, because focusing on digital transformation and really incorporating IT as a core component to the organizational strategy will truly take us to a much better space. And I think, we're all working together during this massive pandemic, and we truly need to come together to really transform our industry, because we are seeing the pros, we're seeing the cons, we're seeing what happens with rushed services, and we're seeing, some items on how do we do this differently next time. Now these organizations are starting to focus on this digital transformation, this digital backbone that's extremely important, incorporating strong cybersecurity initiatives. So again, once this pandemic really goes away, we're going to start seeing a massive increase on these digital transformation initiatives, strategies, which this industry has been in much need of moving forward. So it's just been a phenomenal time, and to really see how the value of IT has really allowed us to properly take care of our patients, because my number one thing has always been, patient care is truly number one, and we need to utilize technology to really improve those outcomes on better initiatives for care and better ways to make sure that we are truly securing our patients' information.
Great. Aaron, if people wanted to find out more information about some of the things we've talked about today from LexisNexis, where should they go?
Yeah, so you can check out the website at LexisNexis Risk Solutions under our healthcare group, or of course you are welcome to reach out to me as well.
Perfect. Well, Michael, I can speak on behalf of everyone here at Healthcare IT Today. Thank you to you and your team and everyone there at your organization for everything you're doing to keep us all safe and treating all the patients. We truly do appreciate it. You guys are heroes, and thank you so much. And thank you to you, Aaron, for being online with us today. It's a real pleasure to have the chance to talk to you about identity management.
Well, thank you very much for having us.
Thank you, guys.
This is Colin Hung from Healthcare IT Today. Thanks for joining.